Hello, my name is Caitlin, and I'm a family nurse practitioner student at Texas State University, and I'm going to be doing a health history on Mr. JC over here. So we're just going to start off with some questions. Just going to start off with asking how old you are.
24.
Okay. And just want to ask what brought you to the clinic today, what your general health is, how you're kind of feeling overall right now.
Pain in my left knee for the past 4 days.
Okay. So that left knee, like what kind of pain is it? Can you describe it to me?
It's just in one spot on the outside of my knee, kind of on the tendon, I think.
Is it like aching, sore, tender, stabbing pain? What kind of pain is it?
Aching.
Aching.
And it hurts more when I put weight on it.
Okay, so more with weight. And what do you think might have caused that left knee pain?
I run a lot, so probably overuse.
Exercise?
Mm-hmm.
Okay. If you could put a number to it, so scale of 0 to 10, 10 being the worst pain possible, what would you say that left knee pain is?
Just walking around, like maybe a 2. And then if I try to run on it, it shoots up to like a 6 or 7.
Have you taken any medications or done anything that helps alleviate the pain at all?
Just been resting it a lot. Maybe like an Advil.
Resting, Advil. Okay. So you kind of mentioned it already, but what makes it worse, you said, is like walking on it and
running.
Else?
Going downstairs hurts more than going upstairs. I wear a knee brace sometimes to kind of keep it from moving around so much. It makes it feel better.
Okay. Well, we'll look more into that later. Some other general questions. Are you allergic to anything, medications or food?
Nope.
No allergies. In terms of a general question, do you have any medical history at all? So that would be like diabetes or heart disease, those kind of things.
Nope. I think my family has heart disease in it, but
We'll get there. We'll get there. Have you had any injuries in the past?
Like physical? Like I sprained my ankle 2 years ago, my right ankle.
Right ankle in 2015.
Mm-hmm.
Okay. How's that doing now?
It's a little stiff from time to time, but doesn't really cause many problems.
Okay. Any surgeries in the past?
Nope. Besides like wisdom teeth.
Okay. How about any transfusions? So that could be blood transfusions, like platelets, or anything like that. And any previous hospitalizations, even as a child?
I don't think so.
Next question. As far as you know, are you up to date on your immunizations?
Yep.
Do you know if you got your tetanus shot in the last 10 years? Tetanus booster?
Yeah.
Yes. Okay. Did you get your flu shot last year?
Yep.
Okay, now we're moving on to family history. So are there any health problems in your family? We can start with parents.
There's some heart disease, high blood pressure.
Specifically? And who?
Oh, and my dad's side.
So your dad has heart disease?
His dad and like the male line of his family has it. I don't think he has it yet, but he has high blood pressure and high cholesterol, so
okay,
he's a good candidate.
Mom?
No, she's fine.
Nothing.
Her side has all been pretty healthy. My grandfather died of a heart attack, but he was 80.
So your mom's father died of a heart attack.
Mm-hmm.
Is your mother's mother deceased? Or?
Yeah, she died of Alzheimer's, but we don't think it was early onset. She got sick at like 70, I think, 68. So she missed the early onset thing.
Okay, and on dad's side, his father?
He died when my dad was 17, and he was bipolar.
Okay.
So.
And your dad's mother?
She's still around, and she's doing fine. Doesn't have any major issues.
Okay, and overall in the family, any diabetes?
Nope.
Any cancer?
Some skin cancer. My mom's father had it, but he also smoked a pipe, and it was on his lip.
Okay.
Other than that, no, not that I know of.
Okay. Next question. What kind of living situation are you in? Do you live in a house, an apartment?
I just moved into a house like 3 weeks ago. I'd been living in apartments before that.
Okay. And is it a one-story or a two-story house?
1 story.
And do you live with family or?
I live with my girlfriend.
Okay. Okay. And what's your occupation?
I'm an environmental scientist.
Okay. So you work at a company or?
Yeah, I work at a Bear Engineering.
Any hazards or anything on the job?
Sometimes we do go and do testing and sampling for environmental hazards like lead. I used to be an asbestos and lead inspector. I don't do that anymore. I did for a few weeks, or like a year or so. And now, sometimes we go out and check for contamination, but usually the levels aren't that high.
Okay. Sounds good. And how much alcohol do you drink a week?
Probably like 4 to 5 drinks tops, and usually only on the weekends, not during the week.
Okay. Do you take any illicit drugs?
Nope.
Do you smoke or use any tobacco products?
Nope.
Okay. Are you taking any prescription drugs?
Nope.
Prescription drugs. Any over-the-counter medications?
Besides
On a
that,
regular basis?
no.
How about any supplements?
Occasionally when I go on a long run of like more than 15 miles, I'll take a salt pill or two. So that'd be like once a week, every other week-ish.
Once a week, every other week.
But that would be it.
Okay. So speaking of running, how often do you exercise?
5 to 6 times a week.
Okay, and in terms of your diet, would you say you eat a healthy diet?
I think so.
Okay, could you give me maybe a 24-hour recall of what you ate? Try and think of what you ate yesterday for breakfast, lunch, and dinner.
I had bagel with hummus on it for breakfast. For lunch, I had yogurt and chicken parmesan. And for dinner, I had chicken, pasta, and green beans.
Okay, thank you. Are there any cultural practices that you take part in that we should be aware of?
No.
Okay. How well do you feel like you sleep?
Pretty good. I don't really have any issues. I get about 6 to 8 hours most nights.
6 to 8 hours a night. Wake up feeling rested?
I don't like to wake up in the morning, but yeah.
Is there anything that you do specifically to maintain your health? So that would be like yearly checkups and wearing a seatbelt, that kind of thing.
I wear a seatbelt. I haven't been to the doctor recently.
Okay, so this is your first visit in a while.
Mm-hmm.
Well, we're glad you came. Make sure you always try and go for those yearly checkups. Okay, those are the end of the general questions I have. Now we're going to kind of move on to what we call a review of systems, which is just going through each body part and kind of asking some general questions about it. So it's going to be like asking about your history, if you had any history of any of these things, or if you're currently experiencing any of these things. Okay, so generally speaking, any significant weight loss or gain that you've noticed? Or has your weight stayed pretty stable?
Yep, pretty stable.
Any weakness or fatigue that you've noticed?
No.
No.
Just my sore knee. It feels weak because it hurts when I put weight on it. That's it.
Okay. Any fevers or night sweats that you've noticed?
Nope.
In terms of your head, any headaches or head injury in the past? or currently?
No.
No. In terms of your eyes, have you noticed any pain or redness to them? Any double vision, loss of vision, blurry vision? Any history of glaucoma or cataracts? With you?
With me? No.
Okay. Do you wear glasses or corrective lenses?
Yes. I have
Yes.
glasses and I'm currently wearing contacts.
So both?
Yeah.
Okay. Do you know when your last visual exam was?
About a year ago.
A year ago. And no problems with that, just
Nope.
you can see fine and glasses are good?
Mm-hmm.
In terms of your ears, have you noticed any hearing loss, ringing in the ears,
Nope.
pain,
Mm-hmm.
any ear infections?
Not recently.
Okay. When would you say you had ear infections?
Probably back in high school.
High school.
It was a while ago.
Okay. In terms of your nose, have you noticed any excessive like nasal stuffiness or obstruction?
Nope.
Any discharge or pain?
No.
Any excessive sneezing or a lot of postnasal drip that you've noticed?
No.
Any dryness?
No.
How about any nosebleeds?
Occasionally. Maybe 3 times a year.
3 times a year?
Usually right when it starts to get cold or if I go really high in elevation.
Okay. In terms of your mouth, any ulcers present? Or have you had any issues with ulcers in the past?
I think I have like a canker sore.
Canker sores?
Like a little bit right there, but come and go. Nothing serious.
Okay. Any bleeding gums? Or like, problems with your tongue, like soreness or dryness or anything? No. Any cavities?
I've had them in the past.
Okay. Do you know about how many?
I think 4.
4 cavities. You've gotten them all filled?
Yes.
And how often would you say you go to the dentist?
Once or twice a year. Somewhere in there.
Okay. Your throat. Any hoarseness?
Nope.
Sore throat? Any frequent strep diagnoses?
When I was younger, but not recently.
How, like, what age?
The last time I had strep was 2011. 2011.
Okay.
But since then, nothing.
How about any other throat diseases or conditions that you've had?
I've been told by my mom that I had something called spiral stomatitis when I was really little.
Okay.
I was probably 2. I don't even know if that's what it was called, but that's what she told me, so
okay.
That's it.
Alrighty. In terms of your neck, have you noticed any lumps or swollen lymph nodes in that area?
Mm-hmm.
Any pain, tenderness?
No.
Okay. History of a goiter at all? It's when your thyroid gland is really enlarged and it makes a very big bump on your throat. Okay. So in terms of your chest, breast area, any lumps that you've noticed, pain in that area?
Nope.
Any increase in the size of the breast tissue?
Nope.
Respiratory-wise, any like persistent coughing? Any difficulty breathing?
No.
Okay.
Nope.
Shortness of breath?
Only when I work out.
Of course. Any wheezing?
Mm-mm.
Coughing
Nope.
up blood?
No.
Have you ever had a history of tuberculosis?
No.
Have you ever gotten that skin test where they look for tuberculosis at all?
Not that I can recall.
Okay. Any pneumonia?
No.
Okay. In terms of your heart, any chest pain?
Nope.
Any swelling in your extremities that you've noticed?
No.
Okay. Any palpitations?
Like what?
Like like you can feel the beating of your heart through your chest. They're like very
random.
quick little beats.
Mm-mm.
No. Usually goes along with like anxiety, that kind of thing.
Mm-mm.
No. Any high blood pressure for you?
For me, no, I don't think so. No one's ever mentioned it.
Okay. Any heart disease? I know we were talking about your family, but for you at all?
No.
Have you ever passed out?
Nope.
Okay. Have you ever had any pain in your calves when walking? It's usually not like muscle soreness. Like if you were to work out, it would be like a different kind of soreness in your calves, like persistent.
Mm-mm. Nope. Just regular muscle soreness. That's all.
Okay. Have you ever gotten an EKG? Have you ever had an abnormal EKG before?
Many years ago, when I was 14.
Okay.
The doctor thought he heard something, but later he told me it was the sound of blood rushing through my heart. And they did an EKG thing, and they said everything was good to go.
Okay. So the only one you had was normal.
Mm-hmm.
GI-wise, gastrointestinal, is any difficulty with swallowing or pain with swallowing?
Mm-mm.
Okay. Any heartburn that you've noticed? Like, frequently after meals you have heartburn?
No, just
No.
the regular, occasionally from time to time, but nothing recurring.
Okay. Any decreased appetite?
No.
You've always had a good appetite?
Yeah.
Okay. Any rectal bleeding
No.
that you've noticed? Any constipation or diarrhea?
Nope.
Any hemorrhoids?
No.
Okay. Now I'm going to ask a little bit about bowel movement. How often would you say that you have one?
1 to 2 times a day
So daily, 1 to 2 times?
after my morning coffee.
And would you say it's formed stool, loose stool?
Formed.
Formed. What color is it usually?
Poop color. Brown.
Okay. Okay, urinary tract wise, have you ever noticed any blood in the urine?
Nope.
Any like frequency or urgency problems? Having to pee? Any pain with urination?
Mm-hmm.
Have you ever had any issues with incontinence?
Nope.
Any trouble starting a stream?
Mm-mm.
How about any kidney stones?
Nope.
Musculoskeletal wise, any history or current arthritis, gout?
Pain in the feet?
It's a buildup of uric acid in the joints.
No.
So if you haven't heard of it, I'm sure you don't have it. Any broken bones before?
No.
Any joint stiffness?
No. Besides like soreness from running. No.
That left knee is not really joint pain, it's more...
Feels more like it's a tendon and not the knee joint itself.
Okay.
So
So
doesn't
no
feel like
joint
it's
stiffness.
inside the knee.
And in any pain?
What do you mean?
Just general pain in any of the muscles or bones? I know we already talked about that left knee, and that's the only place?
Yeah.
Okay.
I mean, I guess I have some slight joint stiffness in my twisted ankle. Old twisted ankle, but nothing serious.
Okay.
Stretch it out.
Is that constant, or is that kind of intermittent?
It's intermittent, and once I stretch it, it goes away.
In terms of neurologically wise, have you noticed any weakness or paralysis in the past?
No.
Any numbness or tingling anywhere?
Nope.
What's that? Any vertigo?
No.
No. Any seizures in the past?
Mm-mm.
In terms of your general mental status, do you have any bouts of anxiety?
No.
No. No significant anxiety or nervousness?
Not really.
No. Any irritability, like frequent irritability?
No.
Any depression or suicidal thoughts?
Nope.
And we already discussed your sleeping, no trouble sleeping.
No.
I'll go on that. Okay, well, I'm just going to open it up. Is there any other history that I might be missing or anything else you want us to know while you're here?
I think we covered it.
Okay. All right, well, thank you. That's it for the health history. We're just going to be moving on to the physical exam next.